This is our fall prevention class. Some of the things that I've learned here, I apply when I walk, when I sit down, when I get up. It teaches techniques so that it's safer. That's what this class is designed for.
When you run a public program, everybody's used to reporting their numbers. We always asked if they liked the program, if they'd come back to the program, but we never really asked in-depth questions, if they were using this at home and if it mattered in their life. Really having the data to substantiate what we know we do is empowering.
What I love about Street Level is how the health piece is there, but it really looks at all of those core determinants of health. Work, fair work, work that pays, housing, food, access to rights. We're running around, like we are literally running around trying to support the programs. RBA at the beginning was like, oh man, here's another thing that we now have to do that's gonna take time, and how are we gonna do it? And now we have these measures that are cool. Like we can see like, oh, okay, this is how we're doing.
What are some of the quality measures that you're thinking for next year?
For next year, something I really appreciated about RBA is that rather than these external measures coming top down, we were able to really think for us, what are the things that would really measure what we're doing?
I would recommend that that's actually a really good impact objective, because what you're describing is access to health insurance coverage.
It's true.
When we first started with results-based accountability, the word accountability created a lot of anxiety. It's really just a framework to help the staff that runs the programs to come up with the measures that fit and make sense for the services that are being delivered.
We'll do updates, these things that I mentioned, and also I'll talk a little bit about work groups.
We will count widgets a lot. How many clinical visits we provide, nutritious food bags we deliver. But how does that actually improve the lives of that community?
Every department is going to be responsible for determining how they're going to be implementing Project Impact and at what time. Project Impact is a collaborative effort across the entire agency and all of its programs to support and encourage the adoption of a results-based practice
Assistance with that.
so that we are secure in the knowledge that it actually has an impact. Nobody goes into public service for the fame or getting rich. They do it because they want to make a difference in people's lives.
I really appreciate you all going through this with us. This is going to support us in moving to a place of developing results. You all are the TAE system of care. This is the movement that we're creating together. This is a collaboration. And so we're going to figure out if what we're doing is helping transition age youth.
For that particular thing, we need to develop one.
What you've already got, what you've told me is like, well, that would be a measure of better off. My life is better, right?
Well, that's good. And I'll put your answer.
With RBA, it's no different than any reporting. It's just enhanced. It gives you a way to say we're awesome in that many more ways.
It has been really helpful in the long term to be able to go to other funders and say, this is what we're doing. This is who we are.
Trying to get better.
A results-based practice allows us to assess how we can do our job better. If we can do our jobs better, that means people's lives are better. That's really what it comes down to.
I just want to make sure that we really feel what just happened here. We have developed population results for transition age youth.